everyone, my name is Myrte Thoolen, PhD candidate at the Eindhoven University of Technology, the Department of Industrial Design. In this video I am going to present our study AmbientEcho, Exploring Interactive Media Experiences in the Context of Residential Dementia Care, which is a joint work with my co-authors Rens, Brankaert and Yuan. Dementia is a brain condition characterized by cognitive decline that has a significant impact on people's daily functioning and life. Its unpredictable nature makes the impact and experience different between individuals. Since the number of people with dementia is increasing and since there is no cure available yet, the demand for residential care is growing. Research has demonstrated that residents report a lack of access to meaningful activities since they are often treated as passive recipients of care that are no longer able to experience things. To anticipate on this, attention is increasingly being focused on including residents in reminiscence activities. Reminiscence activities involve media such as photographs or life stories as a prompt to provide enjoyment, positive experiences, and to encourage social interactions. By moving towards experience-centered technologies, researchers have been exploring the role of design and technology to enrich the personal experiences of living with dementia by building upon the strengths and preferences. Having access to rich and stimulating media can be of significant benefit for residents. Earlier work found that generic photographs can trigger personal memories and elicit detailed narratives that are not bound to a particular place or time, while recent work found that media needs to provide enough context and build on the existing knowledge of residents to provide a meaningful experience. Furthermore, in our previous work we found that to maximize access to stimulating media, the context of use and the offering of media content appropriately need to be explored. But how to provide an enriched media experience in residential dementia care, considering this individual variability? More insight is needed into the format, vehicle and methods of providing an enriched personal media experience in residential dementia care, and whether media can add value to the lived experiences of these residents. This paper reports the findings of a qualitative exploratory study in which we deployed a media-based intervention called AmbientEcho. We used AmbientEcho as a prototype to conduct post-design research to understand the personal experiences with media in situ. We looked at the potential of such interactive media systems in care practice to energize, soothe and stimulate residents. As such, we explored the responses and experiences of residents evoked by AmbientEcho in context and the experience of the system in practice as a tool for people with dementia, their family and care staff. AmbientEcho is an interactive system that offers both bespoke and curated media content through different modalities, designed by the Pleiade Innovation Team, a group of design practitioners and care professionals, with the goal to engage residents with mid to late stage dementia meaningfully through media and design. The system is placed in a half-open room with cozy features such as Dutch cups and a painting hanging on the wall, to provide media in a non-intrusive way. It contains of two types of media. The bespoke media, which is carefully selected content selected together with each participant based on interests and history. The curated media, which contains 6 themes of generic content that are appropriate for a wider group of people based on literature and which are spread over the different media vehicles, which will be explained later. AmbientEcho is designed for easy access to these media types through different interaction means, which will be shown in this video.
To access bespoke media, Joanna wears a necklace with Bluetooth technology. When she is within range of the system, the media content on the virtual window and photo frame shifts to her personally preferred media content. Also, sound and light are activated to support a coherent and immersive experience. When a colored RFID disc is placed in the bowl, the selected curated media will override the bespoke content to encourage curiosity.
To study this, we deployed AmbientEcho over a period of 3 weeks in context in a residential care setting. We worked closely together with one care unit of care organization Pleiade in the Netherlands. The study consisted of 3 phases. Prior to the research, an introductory meeting was organized for family and caregivers to inform them about AmbientEcho and the related study. And during the study, we engaged with participants through participant observations combined with semi-structured interviews twice a week. AmbientEcho was available at all times. Finally, we conducted a post-trial focus group with family and care staff to reflect on their experiences with the prototype. In total, 8 participants were included in the study, 3 residents, 2 of their spouses living separately at home, and 3 care practitioners working at the care home. Approval to conduct this study was granted by the residential care institution, and family members and care staff provided consent, together with their relatives with dementia. A thematic analysis of the field notes and audio recordings revealed that participants built their own stories based on bespoke and curated media content by relating these to their own experiences, as shown in this quote. Audrey started to talk about her personal associations prompted by bespoke content, which was followed by the curated content Relax. The combination of media seemed to trigger new associations and stories, which is also shown in the following example. The bespoke media incited Chris to respond to the sound of a church choir. It resulted in having a meaningful experience in the now for both participants. The bespoke media content proved to be key in eliciting vigorous and lively responses. Even participants with dementia who were usually more introvert and apathetic increased their active participation and came to life. This was especially the case for Deborah, who suddenly started to smile. In another example, a more explicit expression of appreciation was demonstrated by Audrey. These responses to AmbientEcho indicated the rich ways in which media that presented a familiar and trusted environment that was reminiscent of home allowed residents to express themselves by emotionally opening up. The media and its interaction served as a conversation mediator and was used as a way of bringing people together. While switching between media, all care practitioners mentioned that engaging in AmbientEcho evoked a dialogue about significant life events, which they never heard before. The interplay of automatically adjusted content in a half-open space seemed to encourage active participation and social interaction, as shown in this quote. A diverse nature of participation occurred. The use of discs to manually interact with the system interested some of the residents. All participants responded positive to the aesthetic qualities of AmbientEcho and expressed a heightened appreciation to the situatedness and appearance of the installation. The outcome of this study demonstrates the benefit of a combined use of media to support evoking meaningful associations and enhance telling stories. It allows people to choose whether to engage with bespoke or curated content, allowing residents to search for something meaningful for them in that moment. It allows family and care staff to use the system and to find topics to talk about to get to know the residents better. This study contributes to how media engagement through technology can be improved and applied in residential dementia care. And derived from our findings, we want to present design considerations for future design researchers when designing technology for use in residential dementia care, aiming to guide person-centered interventions so that they are sensitive and enrich experiences. A combined media approach contributes to meaningful shared experiences. To further enhance this, when designing technology, we need to find a balance in considering people's unique personal aspects in context to both support them and maintaining agency and evoke shared meanings in a social setting. Engaging with technology can be a barrier for people in care spaces when it requires technical expertise for setup and operation. AmbientEcho has lowered these barriers in its design by creating not only a bespoke intervention, but one which also incorporates technology that supports different levels of use. We found a necessity to enhance an appropriate application of media, where the media is suitable to an individual's interest and open for creation to support a continuous curiosity in using the system over time. To conclude, our study shows how careful design of media systems and media can support a person-centered experience within residential dementia care, setting the stage for future design research in sensitive settings. This study was part of the Pleiade Innovation Team. We would like to thank all the residents, staff and volunteers who provided insight and expertise that greatly assisted the research. Thank you very much for watching, and we are very happy to answer questions via mail. And if you would like to know more about AmbientEcho, check also our demo page.